Cluster headaches are attacks of severe stabbing pain centered around one eye and temple. Along with extreme head pain, people with cluster may also experience autonomic symptoms, which can include tearing of the eyes, runny nose, eyelid swelling or drooping, forehead sweating, and nasal congestion. These symptoms usually last 30 minutes to 3 hours and can occur up to 8 times a day, typically in cycles lasting weeks to months. The pain is so severe it can cause restlessness, agitation, and sweating. While people with migraine may find relief with rest, people with cluster are typically unable to stay still and are often found pacing or rocking due to the severity of pain. Cluster headache can be episodic or chronic. About 90% of people with the disease have an episodic form, which means a person experiences at least two cycles that last for 1 week to 1 year, with remission periods for longer than 3 months. People with chronic cluster headache have cycles that last for at least 1 year but do not have a headache free period, or their remission period will last less than 3 months. Episodic patients typically go into a cycle of attacks when the seasons change, most commonly in January and July. Why cluster headaches are linked to seasonal changes is likely due to the amount of daylight. Seasonal shifts make nights shorter and days longer, or vice versa, which can disrupt sleep cycles, leading to attacks. It is unclear why people get cluster headache, but studies have found connections with the trigeminal pain system, the hypothalamus, and the autonomic nervous system. The disease occurs in approximately 1 per 1,000 people in the US, or 326,500 Americans. Tension headaches are the most common type of headache. Although the cause of tension headache is unknown, theories include increased sensitivity to pain and muscle tension. Most people with tension headache experience a tight or pressing pain on both sides of the head. Tension headaches may last from a few hours to days. Pain is often mild to moderate, and headaches are not aggravated by physical activity. Diagnostic criteria for tension headache includes no more than one associated symptom, such as photophobia, phonophobia, or mild nausea. Moderate to severe nausea or vomiting does not occur with tension headache. Migraine differs from tension headache in many ways. First, migraine typically causes moderate to severe head pain that is often unilateral and may be pulsating or throbbing. Second, typical migraine attacks last 4 to 72 hours and are aggravated by exercise for most people with the disease. Migraine must have had at least two of the following associated symptoms: photophobia, phonophobia, nausea, and vomiting. Like migraine, more women are affected by tension headache than men. Triggers for tension headache are the same as migraine and may include stress, lack of sleep, alcohol, menstruation, and skipping meals. Tension headache is diagnosed by a clinician using the International Classification of Headache Disorders criteria, as well as neurological and physical examinations. During the physical examination, a clinician may identify trigger points or tenderness in the pericranial muscles around the skull. Trigger points are sensitive areas of tight muscle fibers that can cause pain. Other conditions, including migraine without aura, should be ruled out prior to diagnosis of tension headache. Tension headache may be classified as episodic or chronic. Episodic tension headache occurs less than 15 days per month. Chronic tension headache occurs more than 15 days per month for 3 months or greater. Medication overuse headache may present similarly to tension headache and should be ruled out prior to chronic tension headache diagnosis. Using a diary to track symptoms and headache characteristics may be helpful in leading to an accurate diagnosis.